is the interim chief. We were working so hard to get her. That's why I think her stuff got pushed down here. Dr. Pamela Coleman is going to join the Black Physicians Healthcare Network, right? Okay, she's already joined. All right. But she is the interim chief of urology and associate professor of surgery at Howard University Hospital. We welcome you. Please come up as well. And I'm going to turn it over to B.J. Dawkins, and I'm going to take my seat to listen to this great panel. Thank you all very much. Thank you.
Thank you. Thank you. Well, good afternoon, everyone. Thank you so much for coming out to this very important topic that we need to address. This is more like a health crisis when you think about it in the Black community. So first of all, I wanted to say, and forgive me for reading from a paper, but it's what I'm doing right now. So let's begin, shall we? I am B.J. Dawkins. I represent Helping Hands, Empowering and Lifting People. It's about how does addiction affect families and loved ones. And as Will said, it's a personal journey that I'm going through because my daughter died at 35 from addiction, prescription drugs, and alcoholism. And it's personal, real bad, because when I come and I look at in the rotunda during the summer, Rockville goes purple, in case you didn't know. And everybody that they have information on, pictures and everything is hanging there. And you're talking about maybe close to 200 pictures, you walking around the rotunda. One year it was like a U, now it's a W. And I eventually, hopefully not, but it's going to continue like a snake road or something. But this is also not just addiction, but Black health. We need to talk about that. We need to talk about the disparities with our men, the fear, and the culture of it. So as we go into that, what I would like to do is, again, the panelists, Dr. Coleman, thank you so much for coming. I do appreciate it, and I know we dragged you at the last minute. And of course, Mr. Slade, you stepping in for, Mr. Buds, I would appreciate it. And Queen Moody, yes. So I say that about her because every event that I've done, and we talk about mental health, it's important for her or others to be there. But the first thing is like, is Miss Moody coming? Is Miss Moody coming? Because I'm going to be there. Dr. Johnson, thank you so much. And to everyone else, thank you and welcome. So we're going to start with a panel, without further ado, since Council Vice President Jawanda may be busier. One of the things that I wanted to talk about is, and I'll just stand because I'm just yay tall, so sitting don't do nothing for me. So my first question will be to Dr. Coleman. Dr. Coleman, being a true champion in the field of urology, and I've spent years helping men navigate prevention and care, basically, you're the go-to superheroes in scrubs. And we love the fact that you're here today because a lot of men will tell you, oh, I don't want a man touching me. I would rather a woman. So we want to talk about the fear of prostate cancer exam. We have a lot of older, especially boomers, that will say, we're not doing that. But what we want to share with you is you have a PSA that you can do. You can do a blood test. And if there is a detection, then of course you would go to the others. So Dr. Coleman, I'd like to turn that over to you. If you could, is your mic on? There should be a little switch on it. Yeah. Just slide it over. There you go. Yeah, I think it's up.
Okay.
There it is.
Okay. Thank you very much. Good afternoon, and thank you very much, Councilmember, and thank you very much, BJ, for having me here today. This is very, very important and also dear to my heart. I will say that prostate cancer is common in African American men, and probably, as you've already mentioned, 1 out of 6 African American men will probably be diagnosed with prostate cancer in their lifetime. Does not mean that that has to be a death sentence for you, and it should not be. But it's interesting, I like the title, Silent Killer, because it is. It's a silent killer because early prostate cancer has no signs or symptoms. So most men don't even know they have it. They have no idea at all. But what you do have, as you've mentioned already, BJ, is the PSA, or the prostate-specific antigen. So this is a blood test that we start, it's what we call a biomarker, that we start early for African-American men. What do I mean by early? Well, we start first in terms of this blood test in African-American men because there is such a high ratio of acquiring this disease at 40. Now, in general, the PSA blood test should be less than 4. But I will tell you, the younger you are, if you're in the age group from 40 to 50, your PSA should not be 4. It should probably be less than 2.5, okay? As men get older, that PSA blood test will change based on the age, based on the characteristics, and other things that can happen. So it's important that we do keep in mind silence is deadly. And that's why I think it's so important that we're all here today to talk about this disease process, prostate cancer. So I can go on, and I'll stop there, and I will give more information as needed, BJ, as you would like me to.
Thank you so much, Dr. Coleman. I appreciate it. My next question, and actually, you know what, it is so important, but before we go to the next person, can you give a basic statistic as what the ratio is now, maybe 10 years ago and maybe now, if you can, but if not, just give us a basic round.
Okay, so prostate cancer, I will tell you, 10 years ago had a lot of discrepancy in terms of its diagnosis, especially in African-American men. And some of this was based on the research that was done looking at a cohort of patients, primarily white men between the ages of 50 and 65, 69. So what came out of that is that the United States Services Task Force came up with a reasoning for who should we screen and who should we not screen. And they have since amended it to say that men that are high risk, black men that have a family history of prostate cancer or a history of prostate cancer diagnosed early in their younger siblings, relatives, and cohorts should be considered for prostate cancer screening after 40. And before it would be in the age group of 50 to 65. So there has been a shift. There has been a shift to early screening and diagnoses. But let me just backtrack a little bit, if possible. How many people in the audience, and maybe everyone here, even knows what the prostate is? What is the function of the prostate? Perhaps we should start there, right? So let's start there. I'm a professor of urology at Howard, and I have students that I teach. So I always want to start there to say, what do you know about the prostate, right? So the prostate gland is a gland that sits right outside the bladder and encircles the urine tube where your urine comes through in men in the penis, okay. What is the function of the prostate gland? Well, the prostate gland produces semen, which is fluid that the sperm swim through. Now, the sperm are made in the scrotum in the testes. They make their way up the vas deferens, and then they mix with the fluid from the prostate or the semen. The prostate produces an enzyme called PSA, one of the enzymes, prostate-specific antigen. And what is the importance of this antigen? Well, it's a type of protein that cleaves the semen so that those sperm can swim where they're supposed to go to. So that's what we think really is the main reason for the prostate gland. But as men get older, different situations can happen to the prostate gland, and it may not happen to everyone. One of those is that it can enlarge, it can grow. A second one is that it can become infected or inflamed. It may develop benign tumors, and it also may develop cancerous tumors, okay? So what we're here today talking about particularly are those cancerous tumors. So I will say that for the PSA, the prostate-specific antigen, that not always does it mean that you have cancer or there is a malignant tumor there, but it could be a benign process. It could even be a lab error. So when I see patients, I like to repeat it. and make sure that is something true that we're talking about. But going on to say that this PSA test is only one of the biomarkers that we have that we can use to detect prostate cancer. So let's say in the men in the audience, because women, we don't have a prostate that we have to worry about. And I wish we had a breast cancer blood test, but we don't. But once we get the prostate blood test, there are other biomarkers that we can look at to give us an idea how much further we should go. So there are at least 10 other biomarkers that are available with blood, urine, and tissue that can give us an idea, okay, so I got the PSA test, what do I do next? Just wait and hope that everything is good? Or can I talk to someone about it? And I would say the next is to talk to someone about it.
Awesome, awesome. Thank you so much. I appreciate it. Can we give her a round of applause, please, for that explanation? I appreciate you so much. Mr. Slade, so you have some information for us that we're going to talk about. So Mr. Slade is representing, as I mentioned, Mr. Butts, and he joins us from the Prostate Health Matters. He is attending, of course, on behalf of him. And he has some data and some information. So please.
Well, thank you very much for this opportunity to participate in this session. As you stated, I'm with Prostate Health Matters as the vice president of the board, and Derek Butts, our president, really wanted to be here, but he's stuck in Spain due to a mechanical aircraft problem, and he just can't get here today.
I think he planned that. I don't think he.
So he asked me to step in for him. I'm also the executive director of the community ministry of Prince George's County, and we operate a prostate health program supported by the Maryland Department of Health as well. And I'm also a retired Army officer. So in a way of information, we stated that risk factors, we've mentioned those. Age is a risk factor. As we get older, our chance of having issues with our prostate increase. Our race is a risk factor. And as we stated, African American men suffer from prostate cancer more than any other men in the world. And also our behavior is a risk factor. And smoking is a huge problem that can increase your risk of prostate cancer. Your food intake is a problem that can increase your risk of prostate cancer. So even though we have quite a few women in the audience, the food that we consume, avoiding red meats, avoiding fatty foods, eating more vegetables, exercising, sleeping well, all of these factors help decrease your probability of having issues with your prostate. It also helps you in many other areas as well, most importantly being the smoking. And high alcohol intake also is a problem. I do a lot of work with Johns Hopkins and also with the University of Maryland, and we also now have a project with Howard that we're working as well. Obesity is going to be the issue that's going to increase cancer across the board as we go forward. So that's another factor that we really need to consider. And as we talked about the prostate cancer being that walnut-sized gland that was mentioned earlier, we men need to think about that, but we need to think about doing things before we get to the stage of getting the screenings. As I just mentioned, changes in our behavior, but also preparing ourselves for the date that we may get a negative report about having prostate cancer. And that's what, if Mr. Butts was here, that's what he would talk about quite a bit, developing a mindset of resilience where you have exercised, discipline, you've prepared yourself, you've read and learned a lot about prostate health before you get to the crisis stage, so that when you do get a diagnosis, you can not overreact, because many men or some men have a slow-growing prostate, and they can live throughout their lives and not have an issue or need to have a prostate cancer surgery, et cetera. So those are some points that I want to talk about. The prevention piece, as a council member mentioned, he mentioned your first uncle was in stage 1 with the cancer being within the prostate gland. Then it later went to stage 2 and 3 because it was outside of the prostate gland. Unfortunately, we as African American, when we detect that we have cancer, we're often in stage 2, 3, or 4 because we have not been doing the regular annual physicals and those type of things to detect it before the symptoms appear. And we can really treat it, and the doctor can work with you much better when that is detected early as well. So thank you.
Great, thank you so
And
much.
one last thing, Army officers and Army men don't get a chance to make a choice about whether they're going to get screened or not screened. So we men should not be so fearful about getting the screen. Thousands and thousands of other people do it, and it doesn't change your masculinity or anything else to do that. It actually enhances your opportunity for masculinity over the years as well. Thank you.
You know, go ahead.
Yeah, just a few comments. Thank you. Thank you very much for that. I will say that there are a number of women in the audience, and I'm happy to see you there, because women, we bring our men to the doctors, and sometimes we're the ones that are more educated. So thank you for coming out. The second thing I would like to comment on is that in the past, men were fearful. It used to be for prostate cancer screening, we did both the blood tests and the digital rectal examination. But guess what? You can just get your blood drawn. So when you go to see your doctor and you get your cholesterol level and your sugar level, just ask them to throw in a PSA if you're over 40, or if you have a family history, if you're even younger. And that will actually, that's your first test for screening. So you don't necessarily need to have the digital rectal examination. If you get the blood test done, that's great. As urologists, sometimes we do want to do a digital rectal just to get an idea if there's any other thing that we might find, because there are some prostate cancers that don't make high levels of PSA. They're very rare, but they're out there. And sometimes if you have a very sensitive finger, I've done over hundreds of digital rectals, sometimes you can feel something. So if you can just come in and get your blood test done, that's really worth it. It's really worth it. Thank you.
All right, thank you so much. So I'm going to go over to Ms. Moody for a moment, and I'm going to come back to each one. But Ms. Moody, can you tell us about the mental aspect of getting that diagnosis, the fear, the confusion, the withdrawal, all of that you go through?
Thank you. So mental health is a very important aspect of having a prostate cancer diagnosis. It helps you to get the support that you need. A lot of times people who are diagnosed with cancer, they need support around depression, anxiety, also around coping with the diagnosis. Behavioral health treatment will allow a person to be able to get some of the support that they need through individual counseling, also through support networks. Support systems are very important because it normalizes and it helps to remove the stigma around a diagnosis of prostate cancer. They also have peer support specialists with a history of cancer who can help the person and be a sounding board for that person. Also, it's also important for that person to have someone to be able to talk to. They deal with a lot of things. Some of the most common things that they deal with is their mortality. They're concerned about how they'll, if they'll survive the cancer, if they have insurance to be able to pay for cancer, what will happen to their loved ones if they're not there. It also helps you to be able to adjust and address your thoughts around your catastrophizing, right? Looking for the worst case scenario, right? Because you have a sounding board and someone to talk to. Your family also needs support, and they need someone to be able to talk to. So a lot of times, it's really good for you and your family to get the support that you need. You want caring people to support you. And it's a show of strength to have someone support you. Not only do they support you physically, but they can support you mentally. So physically, they could take you to doctor's appointments. They could also help you as far as making sure you have food to eat, but they can support you spiritually. It could be somebody that you go to, you talk to, right? In the past, there was a lot of stigma around all forms of cancer, and especially prostate cancer. So it's really good to have a sounding board and to have someone you can talk to mitigate some of the stress that you're feeling, right? And a lot of people, they don't realize when you bottle it up, it's actually causing more stress. So it's really good to have somebody to talk to and to have a sounding board.
Great, great, great. Thank you so much.
Oh, thank you.
So one of the, we have statistics where the national data shows prostate cancer affects men differently across racial and ethnic groups. Among Black men, the incidence rate is approximately 195 cases per 100,000 every year, about 1.7 times higher than white men, and more than double the rate seen in Hispanic men. Mortality rates follow a similar pattern. Black men face a higher diagnosis rate and are more likely to be diagnosed with aggressive or late-stage disease, just like you just said. And, oftentimes this is due to low screening rates and delayed access to treatment, like Doctor said. So only about a third of Black men report having a PSA screening compared to 37% of white men. So I am going to go to Dr. Johnson with this. What do you think of those stats? And this is coming from a national data.
I think that it's just important to create opportunities for men to dialogue about this. And we got to do that in trusted places. We have to do it in our church. We know that through our men's ministry effort, we've made Black men's health a #1 priority. And we've been able to engage in conversations about health, prostate health, chronic diseases faces Black men as a part of a regular conversation that we're having, and to try to normalize a conversation talking about health, talking about what some of the barriers are. We've held several community forums over the last several months where we have had conversations about mental health, where we have talked about prevention. We've also involved young people, 10 to 17 and 18 to 25. Why is it important to talk to 10 to 17? Because we have to start early with the education process. And when I have 10 to 17-year-olds involved in that conversation, I always invite their parents, because they are the ones, they're still living on their parents' roof, and it's very important that the parents work as a partner with us to try to address that issue, to try to reduce those levels of morbidity. It's interesting, it's always important too to involve the women. Why? Because 75% of all healthcare decisions in families are made by women. And let me say it again. 75% of all healthcare decisions, right? And some will say, well, it depends on the household, right? But the point is that, our effort at the African American Health Program, Black Men's Health Initiative, In It to Win It, what we're trying to impress upon men is they have a right to live long. They have a right to live long. But in order to live long, you have to be healthy. And a lot of times it starts in the kitchen. Given the foods you're trying to eat. Let me just give you my own personal story about that.
So no cassava.
Okay.
No,
right,
no yellow yam
right,
banana.
Right. But it's interesting. I had double hip surgery. And one of the things that I began to do to address that is to, first of all, after my wife threatened me to go to the doctor and get it taken care of, I went on a fast. I went on a fast, and I went on a 40-day fast. For those of you who are familiar with that story, 40 days, a lot can happen. And so what I started doing is changing what I was eating for breakfast. I start moving away from a lot of the fried foods, no more bacon, no more fried eggs, and I began to replace it with a boiled egg, and with carrots, and with broccoli, and with celery, and with tomatoes as my breakfast, and I put a little dressing on it. But the point is that over the last 9 months, that has been my breakfast, because I know how important it is to eat healthy in order to be healthy. And guess what? Eating that way doesn't taste bad. Matter of fact, it's pretty good. But I think that what we have to do, we have to expose our young people to healthy habits early. I had a survey done of 18 to 35-year-old black men as part of the Black Men's Health Initiative. And I had some college students from the University of Maryland who went to Howard's campus, that went to Bowie's campus, and also went to the University of Maryland campus. And they interviewed young adult black men. And here's what they found. One, most of them thought that they were healthy. Most of them thought that they were healthy. That's number one. Number two, a number of them didn't know. In fact, 95% of them didn't know anything about biometrics. 95% of who they interviewed knew nothing about their biometrics, but they wanted to know. And when they thought about eating healthy foods, they thought about going to the organic store, in the root store, and as a consequence, it was too expensive for them to actually pay to eat healthy. But see, these are the things that we have to, one, we got to meet them where they are, and then we have to educate them on the ways in which they can really live long and understanding what it takes to be healthy at every stage of their life. You know, you could be healthy in your spring season of life. You could be healthy in your summer season of life. You could be healthy in your fall season of life. And if you're blessed, you get an Indian summer, and you could be blessed during that season. And you could be blessed in your as you get older, because we know that prostate cancer really affects a lot of black men in the after 40. And that means that we should do a lot before that occurs. But I think that having those public dialogues, and I see a member of my advisory board, Dr. Eugene Taylor here, who is also my personal physician, who's taken it upon himself to get involved in these conversations and to make sure that folks have the right information. And Dr. Taylor has come to the forums and said that you don't have to get the rectal exam, you know, to say that, look, there are different ways of doing that. But doing it in barbershops. We have a barbershop campaign where we go in barbershops, we set up a poster, and we're getting men to take pledges. Taking a pledge to good health. And I'll end with this, that since February, our goal is to get 1,000 men to sign a pledge for good health as a part of Men's Health Month in June. We started in February. We got over 300 men to actually sign the pledge to practice good health habits. And what we're doing is quarterly monitoring them to see how they're actually, what actions they're taking. And I am happy to report that for the most part, and these results are preliminary, men are taking the pledge seriously. It's, you know, they're exercising different, they're eating different. They say they now they have a way of going in and talking to their physician, because you really need to know what's going on with you. Right. And the final thing I say, we have to get over this notion that everything that happens to black men's health, you know, should be looked at in the context of what happened with black men with the Tuskegee experiment. That always comes up. We have to somehow, you know, that's important, because we got a lot of mistrust. I think about 22% of black men actually mistrust the healthcare system. So there's some work that we got to do there. But I think it's changing that narrative, that it's important to know that you have a right to live long, but in order to live long, you got to eat healthy, and you got to be educated about what it really takes to be healthy at every stage of your life.
Great, thank you so much. Can we give the panelists a round of applause, please? This is great information. This is great information. Thank you. So, you know, as I mentioned before, when he said about only a third of black men report getting PSA screening compared, but these numbers are not just statistics. These represent fathers, brothers, sons, you know, cousins, the male in our family. And this is where, as women, we come in. Okay, so we are the supporters. We are the ones that's saying, you know what, you haven't gone to the doctor, you just turned 40. However, because there is something going on in the family going back, let's do something about this. So I'll go to the doctor with you. Caribbean men, African men will tell you, I'm not letting nobody touch up there.
Right.
You know, and I'm not going to do it. And that's where a lot of the fatalities come in. So to me, it's like committing suicide, because you know it's there, you're not doing anything about it. So that's intentional. However, when we go back to the stats where you're worrying about what it does to the family, for the mental aspect of it, is like, what does it do to the family? So like Will got a chance to see his father suffered and eventually passed, and then listening to his story. Mr. Slade, you have I'm sorry, not Mrs. Slade. Dr. Johnson, you mentioned that what you're doing in the barbershops. I think it should be everywhere, not just in the barbershops. We should have these conversations in school, just like you said, mention the age group. So we need to find some way of getting into the public school system and have a conversation with these young men, especially our high school students, right?
And I think also, it even starts earlier than that. I think that there's research out there that says that, most of the time when children are exposed to the hospital,
Right.
they're going to get a vaccination.
Right.
And that kind of turns them off to the healthcare system early. And one of the things that one of these projects is doing around the country is actually taking young students in elementary school to the hospital to see the hospital as a friendly setting and not a setting where they necessarily and go get shots. And so why is that important early? Because you don't want them to fear health care.
Correct.
You don't want them to fear that, so it starts real early. And it's also important to, again, from the standpoint of younger people, is sowing a seed of health. But it starts early, and it starts with educating parents because, again, a lot of our young people, they adapt the same behaviors and attitudes towards health as their parents have. And you really have to get the parents. So it's a community effort. And I think that particularly with black men, the problem is so urgent, it cannot be a one-on-one conversation with black men only. Yeah. There is time and a place for that. But it's so urgent, it's a community matter. And we got to partner and team up like we're doing right here. And then we have to do virtual things. We have to in effect, flood the zone with information about this and normalize the conversation. Because it's not a normal conversation to have in the barbershop. So what we're doing, we're actually going in, making screenings. And let me tell you something, every barbershop is different. My dad was a barber too, and so I grew up in the barbershop, so every barbershop is not the same. It's also important to know that health insurance may be a concern, but there are men that I've talked to who have platinum health insurance, but they still won't get checked out. And so health insurance is only good if you use it. And so it's those type of dialogues, but normalizing in such a way that we're encouraging men and we're not shaming them, and we're not trying to make them feel less than because they have not adapted the health behaviors that we want them to have.
Thank you so much. One moment. Mr. Slade, you're representing Mr. Butts. Mr. Butts had an experience, and you're aware of it. Can you share with us, please?
Mr. Butts, like the council member, his father had prostate cancer, his uncles had prostate cancer, and he knew that it was going to come a time when he would get that diagnosis of prostate cancer as well. He's a cyclist. I think he cycles sometimes 50 miles or more a week. He's a karate black belt or martial arts instructor. So he set about preparing himself mentally and physically to the day that he would get the diagnosis of prostate cancer. And that meant intense physical activities, exercising, and then when he did get the notice, he was prepared to have his prostate removed. If I can just deviate a minute. Often we African-American men would rather remove our prostate than to be concerned about it coming back later on as an issue.
Right.
But many of the urologists that we've worked with, the standard that they want to have is what we call active surveillance or watchful waiting.
Yeah.
And most African-American men don't want to do that because of the aggressive prostate cancer that you mentioned earlier. So that's another reason why we need to educate ourselves. And I need to throw out another term, informed consent. Rather than just doing the screening, we need to have informed discussions with our doctor, with our family members, and others about whether we're going to get screened or not get screened, because we want to know how we're going to respond to that screening. When we get that number back, if it's high, if it's not a false reading because of other activities we've done, bike riding, horseback riding, sexual activity, all of that will give you a higher PSA, but it's not your true PSA. You need to know the trend. We say it's like your car. You need to know how you know your car. You know how your engine operates. You know when the oil is low, when it's not low. And you can tell when a mechanic tells you something about your car, you can judge what that mechanic says because you know your car. Same thing about our bodies. We need to know our bodies to the point when we get a reading that may not be accurate, we can say, well, no, 5 years ago, my PSA number was 3.5, and now you said 7 or whatever. That may not be a real accurate reading. But I'm going to check each year, as I was discussing with the men over there, through our annual physical, so we can start getting a trend of what that PSA for me is and what it should be, so I can know how to make some type of decision about screening and about the diagnosis, should I get a diagnosis.
Awesome, awesome. Thank you so much. I'm going to come back to Dr. Coleman. When we talk about the flags, the warning signs, most times prostate cancer does not show warning signs, but as Mrs. Slade just mentioned, you know your body. So when your body is giving you little flags and you're not paying attention, but when you stop paying attention, sometimes it's too late. Can you talk about what may be some of the warning signs, if any, that men get?
Sure, thank you for that question. There's so much that I would like to say in reference to what we have heard.
We're going to have some time. This is not just it. We're going to take an intermission after this, and then we're going to do some Q&As and stuff. So if you have any questions, if you want to jot them down or just have them ready, we're going to roll. We're here until 5:30. We're going to do what we have to do to get this information out. So please, thank you so much for bearing with us. I appreciate you.
Okay, thank you again. So a couple of things, like as I mentioned, that it is a silent killer. You may not have any signs or symptoms, but you may have some. And just speaking to the men in this room, did you know that the nerves that go to your penis for your erections run alongside the prostate? So if you have any issues with erectile...
No, I'm sorry. How many of you men knew that? Okay.
Okay.
I love
Yes.
it. I love it.
All right, this honesty is great.
At least he's honest. Anyone
Yes.
else? No? Okay. I'm sorry.
So I bring that up because I will often see men come in and ask me or talk to their doctors about erectile dysfunction. Okay, we see that on television all the time, advertising different medications for ED and treatment. But these nerves that run alongside the prostate, if there's some issue with the prostate that may be bothering these nerves, that can actually be an initial sign that I sometimes see of men that I need to do a PSA to detect prostate cancer. So come on in. All these people experiencing ED, that could be a sign. Now, the other ones that you might see, which are really more with enlarged prostate, can be concerns with your urination pattern. Maybe you were able to sleep through the night, and now you're getting up at night. Well, we'll give you maybe once at night, maybe twice at night. But when you start getting up more than twice at night, 2 or 3, 4 times a night, that may be a sign that something is going on. It could just be maybe what you had to eat or drink. It could be an infection, or it could be some inflammation. The other thing, if you notice, remember I said how the prostate was located outside the bladder and around the urethra? Maybe that prostate is pushing up on the bladder and making it difficult for you to start your stream. Maybe you have to wait longer than you had to do before for your stream to start, before it to get going. So some of these things. So you know your body, as you said, and so you know if something is not the way it used to be, and maybe you've kind of put it off for a while and said, I'm going to just keep putting it off, but then finally you have to come in, and you should come in and see your doctor, your primary care doctor, and get evaluated. Don't be afraid to be evaluated. Knowledge is powerful, right?
And knowledge will save your life. So we're going to take
Can I make one more comment? Just one comment. You said knowledge will save your life. Prostate cancer is one of the highest survival rates when it's treated than all of the other cancers. And the doctor can talk about that later on. So prostate cancer is not a death sentence if you respond and recognize that we have a better chance of having a successful surgery and recovery than other forms of cancer.
Thank you so much. Panelists, esteemed panelists, thank you so much. We're going to come back after this intermittent break. So if anyone wants to use the restroom or just grab a bite to eat or something, that'd be great. Or just start networking. But thank you so much. It is appreciated. And let's take a few minutes break. All right, thank you.
Myself and others working on that. The relationship the health has had with Howard, it was dormant for somewhat, but now it's being brought back.
Thank you all for coming back, returning to our second portion after the long intermission that we had. But most importantly, the message, the conversation is starting, and we hope that the conversation then is then taken out. So when you have, like, for instance, we have a gentleman there, and actually, you know what, before I do that, let me ask everyone to introduce themselves. I think this is where I'm going to start this session, is just introduce yourself. What do you do? What's your name? What do you do? And if you live in the county. And I'll start with you, sir. Yes, please.
Hi, my name is Malcolm Martin. I'm with Black Physician Healthcare Network. I live in D.C., but I work in Montgomery County.
Okay.
Hi, my name is Malcolm Martin. I work with Black Physician Healthcare Network. I am a patient navigator. I do not live in the county, but I do a lot of work in the county.
Good afternoon. I'm Anne Marie Kaur, and I am the coordinator for the Black Physician Healthcare Network. I live and work. I lived in Montgomery County. I grew up here, but now I've just moved to Prince George's County 2 months ago.
Bye-bye.
So, yes. But I do all my work here, and thank you for having me.
Thank you.
Hi, good afternoon, everybody. I'm Dr. Keisha Davis. I am your county health officer. I live and work and play in Montgomery County for generations and generations, and I'm happy to be here today.
Thank you.
Hi, everyone. I'm Eugene Taylor. I'm a family practice physician. I work in Laurel, Maryland, but I live and reside in PG County.
You got to say it correctly. You know, they don't like PG. They want Prince George's.
Good afternoon, everyone. My name is Alistair Bowie. I live in Rockville, Maryland, in Montgomery County. I represent Hope Connections, which is a not-for-profit community organization that provides support for those who are diagnosed with cancer, their families, their loved ones, caregivers, and those who are bereaved.
Okay, thank you.
Hi everyone, my name is Ingrid and I'm a volunteer for the council. Oh, can you hear me now? Okay, so my name is Ingrid and I am a computer science major at Montgomery College, and I'm also a volunteer for the council member Will Chumwando. I'm happy to be here. Thank you.
Thank you.
Hello, I'm Christina Neidlinger. I'm a staff member in Council Vice President Juwando's office. I cover the Health and Human Services portfolio, and I'm our lead for constituent services as well. So those of you who live in the county, Christina Neidlinger, you can call me, email me, I can help out. Thank you for coming today.
Thank you.
Hello, my name is Belinda Stevenson. I live in Anne Arundel County. I am a startup human service provider. My organization is We Rise USA. I will be providing services to the intellectually, developmentally disabled community.
Thank you.
Good afternoon, everyone. My name is Robin Russell, and I'm the Executive Admin Assistant for We Rise USA. I live in the Anne Arundel County area.
Thank you. So we got Moco, we got Prince George's, and we got Anne Arundel. I like it.
Hello, my name is Newton Yang. Today I'm working as a volunteer for Will Juwando, and I live in this county.
Thank you.
Hello, my name is Azim Ross. I represent For the Good Therapeutic Services. We provide mental health therapy for families, individuals, and groups in Prince George's County is where I live. I'm from Washington, D.C. I do work in Montgomery County, Virginia, and Georgia as well.
Thank you.
Good afternoon. My name is Roxanne Carter, and I am a consultant working with Community Ministries of Prince George's County, where Mr. Slade, who is a panelist, is here. And I'm thankful to be here.
Thank you.
Good afternoon. My name is Carol Joseph. I'm here to support my husband. We live in Montgomery County. My daily job is a dental hygienist.
It's good to keep your teeth healthy. Thank
Security at Beltway Plaza.
Oh, His name is Perry Joseph.
So you're the 100% person that makes the decision in your family, right? And I'm Michelle, and I'm a community advocate. So glad to be here to support BJ and the panelists. So thank you.
And where do you live?
MoCo.
There you go. We got him right there. We have somebody right here. That's okay. You can be behind the scenes, but we're functioning because you're here. So can you identify yourself, please?
Joel Clifton with TABS, Montgomery County Government. Live in Montgomery County as well, Aspendale.
Thank you. Photographer.
Videographer.
Oh, videographer. I'm sorry.
I'm Kinsey, and this is True. And just like you said, we're behind the scenes, but we're with Montgomery Community Media.
Okay. I agree. Thank you. So as you know, we have our panelists, Dr. Johnson, Ms. Moody, because Lord knows we need mental health going on right now. We need a lot. You know, we have Mr. Slade and of course, Dr. Coleman. So again, thank you so much for coming back to continue the session. First one is very spirited and very informative, and I'm hoping that everyone takes something away from it. So again, we're asking you to share the information that you get this way, that you're hearing, this way other people can know about it. I do have some questions for the panel. And my first question is, what is new, promising in prostate cancer treatment that gives you hope? So I will, Dr. Coleman, please. This is for each of you, but I'll start with Dr. Coleman.
Okay, thank you for that question from the audience or those that are out in the internet there. What gives me hope about and new for prostate cancer is that it's not a one-size-fits-all. We have biomarkers specifically that if you do get that PSA and say it is above 4 or the normal 2.5 for younger men, then there are other things that can be done. There are other markers that can be done that will be helpful to try to tailor what needs to be done for you next. So what I mean by that is that besides having the blood tests or other blood tests done that can give us a more specific idea of, say, proteins that are in the urine that we find with prostate cancer, proteins that are in the blood, imaging tests that can be done to look for areas, abnormal areas on the prostate gland, such as targeted MRIs. So I am hopeful. It's not your granddaddy's prostate cancer that it was before in the future, but there are newer things that can be done that can really help assess and tailor, because some people are afraid, like, oh, am I going to get a biopsy? Am I going to become impotent? Am I going to become incontinent? You know, what's going to happen with me? And this is a conversation that you want to have with your doctor and probably primarily somewhat your urologist, so that some of those fears can be allayed, because there are newer and more advanced technology for diagnosing prostate cancer besides just the PSA.
Thank you. Mr. Slade?
I think I'm going to twist the question a little bit. I think I'm hopeful because the knowledge about prostate cancer and other cancers is increasing within our Maryland state. And I think that we've noticed over the years that the numbers are going down, the mortality rates are going down for the various cancers. And so I'm hopeful in that regard, as well as immunotherapy and those type of things that the doctor was talking about as well, is being developed as cause for hope as well.
Thank you. Ms. Moody?
So from a mental health landscape, I would say I'm most hopeful for the fact that we have started to embrace integrative care, where we're looking at mind, body, and spirit, and really treating the whole person. And that's the premise of Montgomery County, what we're built on. So I'm very hopeful. It's not new, but it's something that everyone is embracing.
Thank you so much. Thank you.
I would just echo that and say that as part of our integrative approach to health approach at Black Men's Health, In It to Win It, is that we've actually included dancing as a part of integrative health. All right, to work on your cardiovascular, to work on your emotional aspect of your life, to work on your social aspects of life. So we're doing that. But I'm going to repeat something that was said earlier, and I just want to make this statement. Early detection gives us nearly a 90% success rate. All right, and getting that knowledge out and to really direct it at black men in a lot of different settings, in the barbershops, in the churches, having community dialogues, both in person and virtual. That's how we've been doing it over the last several months. We've had over 300 men to sign the pledge to practice good health as a result of those activities. And so I'm happy to say that's happening. I also like to say that what's happening, and BJ, you are facilitating that. It's a team approach. You know what I mean? It's a team approach. One organization can't do it. One initiative can't do it. And I think that having this today is a great expression of teamwork. And I think that people, seeing this will really benefit by seeing us working together to try to make a difference in the lives of our community, particularly the health of black men.
Thank you. And just for the record, this is not the last. This is just going to be one of many. We're going to be reaching out to our health chief right there and the team, and we will have others. We may have colon cancer next. We may have, breast cancer next. We may have just mental health. But either way, we're going to be branching out because that's what keeps Montgomery County going, and that's one of the things that make us the best county in the state of Maryland. So, okay. So my next question. Oh, no. We will always be the best. Glitches here and there, but we're the best. Fortune magazine said Silver Spring was, one of the best to live in, and also Rockville was one of the best for business. So what? Okay, so this question is to everyone, and actually, how can undocumented MoCo residents find care? So let's start with Mr. Johnson.
I think that the African American Health Program is a way to do it. I think that it's set up for the county to really have a kind of a cultural emphasis on reaching African American people in general. My particular work focuses on black men, but I think the African American Health Program is a way to do it. You can go look on that website. And it's so many activities, free activities a month, fitness classes, nutrition classes. Again, we're getting ready to do dance classes, dancing for men's health. All these are free. It's interesting, as I even look at the DMV, and we talk about health screenings. The health screenings are free. They're free not only in Montgomery County, they're free in Prince George's County, they're free in D.C. WPFW is one of our community partners, so I get an opportunity to go in there once a month to talk about, black men's health. And from time to time, folks call in and say, well, it sounds like you're doing all these things in Montgomery County, but what I try to make them aware of is that it's happening. Screenings are, for the most part, free, across the country. It's just a willingness to step forward and to get your screening. And that's your baseline. That's your baseline. We know that's not a diagnosis, but it does let you know what's going on, with your glucose, with your A1C, with your blood pressure. And all these things are really important in terms of understanding your health. And so I would say African American Health Program, and in particular, I would say for black men, the Black Men Health Initiative, because we are in it to win it when it comes on black men's health.
Right.
Okay.
So in piggyback on that question is, okay, so how do you advertise your information except going to the website? So if these people didn't know about the website, where are you putting this information for the public to see?
We're putting posters in barbershops. I wish Nelson was still here. We're putting posters in barbershops.
But I don't go to barbershops.
Okay, we're putting it in rec centers. We're putting it in rec centers. We're putting them in our church. I've made, as part of our men's ministry, a big focus on health. And that we have our Health Heroes luncheon there. We plan to invite Dr. Coleman to come in and talk about prostate cancer. But I think the point is that you have to go to trusted places where young people are, the schools. Again, this is a conversation that I wish I could say was happening in biology classes, but they're not even learning about what we're talking about. We have to really empower our community-based organizations and our faith institutions, to stand in the gap when it comes to that. But it comes with education. It comes with involving folks like we have here on the panel, so that you can have a general dialogue, but you also need to know, something very specific when it comes to certain, health behaviors and medicinal approaches to health. That's also important for people to have. And I think this dialogue approach that we've begun as part of this this Black Men's Health Initiative, we've had over 250 people in dialogues, about how do we work together to address any number of health outcomes. We work with the National Council of Negro Women Montgomery County chapter. We work with the National Council of Negro Women Potomac Valley section, and all of them work with us to get the word out. Because you can't do this stuff by yourself. It's a community effort, and working, again, those trusted locations where Black men go. I'm working with football coaches, around this whole thing. One of our health heroes is a 35-year-old football coach, who had an obesity problem. Got up to 350, body started breaking down. His father died of prostate cancer. His grandfather died of prostate cancer, and he's concerned about his own health. So he lost 100 pounds. And what he's doing now is coaching his boys, and he actually brought them out to one of our health forums as a way of exposing them and sowing that seed early.
Okay, thank you so much. Because one of the reasons why I'm asked that question is because if you're advertising, we have a lot of free publications around, and we have, even with the women's, Montgomery County Women's Association, if you are pushing this information there, because for instance, for me, I get these emails every week, but I'm not seeing that information on there. So we need to find a way to get that information out there. So other people that's not going to a barbershop.
That's right, I agree.
Other people that are, that are not in schools anymore should have this information because it's so vital. Dr. Coleman?
Yes, thank you very much. Also, I think most people have access to the internet and the computers, and not to really to direct it at any particular group, but you can use AI. If you put in there prostate cancer screening, some of those things will come up. And I will mention also at Howard University, we do free prostate cancer screening. We usually offer it at least once a month, and so people can come and get it done. We have a grant that we've had for a long period of time for people age 40 to 74. We usually try to screen between those time periods, and so that is available. The other thing I wanted to mention, we had talked a little bit about the Tuskegee Institute and what happened there, and I know a lot of people sometimes are afraid. There's a stigma associated with coming and getting screened, and we have to take into account that what happened with Tuskegee was wrong.
Right.
It was very, very wrong. People were hurt by it. But what I want you to take away that's not the same today. We have people of color that are working on research projects. We have physicians that are also of color, Black and brown, that you can feel trusted. You can have an understanding with them, and you can go to them and talk about your health. So things have changed. We have learned. You have learned. We should be empowered by that, and we should go forward with that and speak with those members that we trust. Because studies have shown that people do better when they seek care from people that look like them,
right,
and that are trusted and that are really invested in their health care.
Thank you. Ms. Modi, you had something to say on it? She got it? Okay, awesome.
Thank you.
Sure.
From the health officer perspective, so just a couple of resources I do want to highlight in the county, one of which is the Montgomery Cares program. I want to highlight the Montgomery Cares program, which provides healthcare access for folks who are uninsured. It provides primary care, behavioral health, and dental. And as part of that program, you get a primary care provider. And that's the goal. We want people connected up for care, and they can get their screenings. They can get their digital rectal exam or PSA once they become a patient. We have 11 safety net clinics throughout the county who will then provide that screening, as well as check their lipids and cholesterol and blood pressure and A1C for diabetes. So we really want to get the word out for people about that program, the Montgomery Cares program. Also, the Black Physicians Healthcare Network, which will help connect people up to, if they specifically want a Black physician, to help them find them. And they also have resources to help for payment for those services. They also help with primary care, behavioral health, and for dental. So two resources specifically for folks who are uninsured or underinsured to help get them connected up to care.
Great, thank you so much. Great information. I'm loving this. I'm glad it's going to be recorded and sent out. Okay, my next question is, how does a man decide whether to get PSA tested? How do they decide, and how often? Yes,
Earlier I mentioned the informed consent. So how does a man decide whether or not to get screening? And that is what we call the informed consent, and that is through reading about screenings and recognizing, as we stated earlier, about your family history. If you have a history of prostate cancer in your family, then age 40 for African American men should be considering screening, 45 for just regular African American men, and 50 is for the other men. But that informed consent is about talking with your family members about what you're planning to do in the screening, talking with your doctor, and actually having a conversation. If you have a doctor that will not talk with you about these type of things, then you need to consider the possibility of getting another doctor, because it's important that you know that you approach this with knowledge about what you're getting into. So I think that's one of the ways that you decide, and I'll defer to others for additional as well. And of course, if you see any of those symptoms that were mentioned earlier, that should spur you to really check, frequent urinization, blood in your urine. We talked about pain during ejaculation or other activities. All of these type of things are symptoms that you want to, if you've reached that stage, you definitely want to consult with your doctor about it.
Thank you. So one of the things also too is that, when we get our annual, it's like for us women, we get tortured. we get tortured every year. So it should be mandatory for the men, whether they ask for it or not, to be told that this is a requirement for you to get done, especially at your age. Because we women, we get 20, 30 reminders that a mammogram is due. And, so on and so forth. So somewhere along the line, maybe we can talk to Governor Moore's team to find out how they can streamline it in a sense to be more inclusive for people to know, because some people don't know or they don't understand the importance of it.
We do need to talk about that, but we also, unfortunately, need to recognize that there's a controversy about men getting prostate cancer screening.
We know.
So what you have to do, you have to tell your doctor that you want to get the screening. And you don't have to lie, but if you can find any history in your family of someone with prostate cancer, tell your doctor about that as well, because in the former PSA preventive task force recommendation, the recommendation was not to get screened. And now the recommendation is under certain conditions to get screened. So you have to be an advocate in order to get that screening.
Right, that's what I was saying, that somewhere along the line, we need to have it set up the same way it's mandatory for a woman to get that. When you're getting your blood work done on your annual visits, that should be a part of it. That PSA should be done. Yeah.
Yes, I definitely do agree with that. I would say that the other importance is just getting a baseline test. I mean, it doesn't mean that you're going to get prostate cancer because you got a PSA blood test. But if you're 40 and you have your baseline test, then you can be followed annually, so we can see, medical term is the PSA velocity, but if we can see if there's a change in your PSA over time, it shouldn't really go up that quickly over time. And so if it does, that may be something that's like a warning or a warning sign or something that we really want to look at and pay attention to you. And the other thing I'd just like to mention is that not all cancers are the same. So there are different types of prostate cancer in the realm of cancer. So some, as we've talked about, some can be actively followed, active surveillance, watchful waiting. We might use for a term for older men to see if something's going to happen, if we want to intervene. We've had, just example, presidents in the past have been diagnosed with prostate cancer early on. Nothing was done because nothing needed to be done at that time, but as they became more symptomatic, then something needed to be done. So if you do get that test done and you do go forward and you have a biopsy done and you are found to have prostate cancer, the other test, as you get educated, you want to know, what is my scale? What is my score? What type of prostate cancer? And we score them on a scale of 6 to 10, but 6 maybe can be followed. 7 is intermediate. I mean, these are just what are called Gleason scores. So just keep in mind that not all prostate cancer is the same. There are different cancers within that sort of garden of cancers, and they are treated differently, and they don't necessarily all require surgery, and they don't necessarily all require treatment.
Thank you for that clarification. That's important. Next question, how can, I'm sorry. We're gonna do a Q&A after this. Right. How can men start conversations about prostate cancer with their doctors? So I guess whomever, I'm not sure if this question was done online or like this, but how can they be, make them a little more comfortable having that conversation?
The doctor mentioned, Dr. Coleman mentioned AI. You can search. What I'm getting at is that when you go to the doctor, you should have a list of questions that you want to ask the doctor. And you can go to the University of Maryland website, and it's posted there, the question that you ask. But you can also just Google or AI questions for your doctor about prostate cancer, and then have those available to you. So when you go into the doctor, you can have that conversation and be informed about it.
Okay. Ms. Moody, I have a question for you that's not pertaining to this question. And my question is, have you dealt with or had conversations with patients when they found out they have it, the mental aspect of it, the fright, the scariness, and so on? Can you speak on that for about a minute for me, please?
I haven't had any personally who had prostate cancer. I've had people in my family who have had prostate cancer, and because of their relationship with me, they didn't want to talk about it with me, and I respected that. So I wanted to give them self-determination and respect around their diagnosis.
Right. So Dr. Coleman, when someone gets that, especially if it's stage 3 or 4, what has been your experience dealing with that patient?
My experience has been one of empathy, not necessarily sympathy, but sometimes it takes more than one discussion when I'm talking to a patient and diagnosing them with prostate cancer, and then going through the workup, maybe looking at the stage and trying to determine the stage where they are with prostate cancer. But I really would like to, and I'd like for when the family members come in also, the significant others and the partners that come in, because that can be very helpful, and also bringing in questions with you, because sometimes you get there and you're just immobilized by the diagnosis, but maybe if you have questions, it will bring you back. And I try to get people to focus on the process, not necessarily so much on that C word, but it is important to focus that on the cancer, on the C word. But there is a process, there's an objectivity that we need to go through so that we can get to the end, to get in it, to win it, and have a better outcome. So that's why programs like this, I think, are so important for prostate cancer screening, because this is your sort of the first, chain of events to try to get things started. But it is a very sensitive diagnosis, and sometimes people feel like they're branded because they've been told that they have cancer, and they're just startled and just mesmerized by it. But I think over time, that as we do more talking, as we stream it in, flood it in, that it won't become such a, and prostate cancer it's very different from pancreatic cancer. It's not a death sentence. Right. It's not a death sentence at all.
What I want to say is...
One second, Dr. Johnson. Mr. Slade?
I was going to just simply say that Derek Butts, who is the president of Prostate Health Matters and is a prostate cancer thriver, survivor, he does one-on-one journeys with men who've been diagnosed with prostate cancer. So I would encourage you to, we got a flyer out there, Prostate Health Matters website. Check out their website, contact us, and he will actually do a one-on-one conversation with you over a period of time after you've been diagnosed with prostate cancer as well.
Okay. Thank you so much for that information. That's very important.
I was going to say that, we have these conversations in our men's fellowship, right? In other words, we have the tough conversations, you know what I mean? Because we're looking out for each other, and we want to make sure that we know what to pray for, you know, and so we create the environmental condition for men to feel okay to say that, and when one man starts, others begin to talk as well. I also would like to say that we need to, you know, go where men are, and I think we have to do a better job, you know, in getting, you know, our Divine Nine, you know, because again, they have to stop being. This is a life's journey. This is not a sprint. This is a marathon. And so I know, you know, a lot of the research I was doing on Black men health initiatives around the country, you know, they were like in for 1 year, out the next year, in 1 year, you know, photo op, you know, kind of opportunity kind of thing. This stuff is serious, and that what we have to do is impress upon folks, once you get involved in this, stay involved with this. Don't make it a 1 year project, a 2 year project. Make it a project that's going to last, you know, in perpetuity, because you can't walk away from life, you know, and this is a conversation about our lives. And so I just think that talking about it often, again, I'm going back to those trusted places again, where you can have those conversations. And if you have to come up with a kitchen cabinet, you know, 2 or 3 people that you can confide in, do that. Through our Health Heroes program, we've set up like a support group, you know, for pancreatic cancer, you know, for kidney, you know, men going through stuff, having other men to talk to who've gone through it, to let them know they can survive. But I think the dominant conversation, I think in forums like this, is prevention. Prevention is always better than cure. And so just the focus on prevention is where this message has to be, and it has to start early.
So normalizing the conversation.
Yes.
So talking about it, removing the stigma, and letting people know that you care.
Yes.
And just being there for one another.
Yep, that's great.
Thank you so much. You had a question, please? Oh, I'm sorry. I got it.
Yeah, I have one question or thought. In the countries that I work, I did international public health until about 2 years ago, where I'm doing more domestic. We do, with the organizations I work with, they, apart from just the digital and the PSA test, they do a transrectal exam using the ultrasound and the Doppler. Why is that as part of their annual exams? Why is that not part of what we do here? Because with the early detection, that would be an amazing piece, and you can look at the pictures year after year and see if there are any slight changes. And then, as you mentioned about prevention, we can look at it from a primary, secondary, tertiary prevention piece. Why is that not a part of what we're doing as just standard for our healthcare?
Yeah, I can take that question first. Thank you very much for the question. I would like to say that when we're talking about prostate cancer screening in this country, we're talking about screening. So what is a good test that people will come and get done that doesn't seem to be too invasive? And I think for the most part, the blood test, the PSA, is what we do now. Some physicians and myself and others may also do a rectal exam to sort of complement that, especially when we get an abnormal PSA, or we have a patient has symptoms of enlarged prostate gland and we want to tell something. But there are also other tests that involve urine. So some people that are afraid of that needle, there are also urine tests that are now becoming more involved in terms of screening for prostate cancer. Now, for myself, once I get ready to do an imaging test, like you've mentioned, a transrectal ultrasound of prostate, that involves putting a probe into the rectum and scanning the prostate using the ultrasound machine, like what we do when we're looking at pregnant women to see the baby and everything, which is more external, not necessarily have to put anything in the vagina to see that. But that is a little bit more invasive, doing a transrectal ultrasound, and I tend to use that more if I'm looking at, want to get up close and personal with the prostate, or if I'm doing a biopsy. But even now, even less invasive or less intrusive putting something inside of someone is doing like an MRI of the prostate or the pelvic area to get more information that way. So I would, it's interesting that that test is available in the country for transrectal ultrasound of the prostate, but I would say here more commonly for screening now, we're looking at the blood test, initially kicking it off with the PSA, but there are other biomarkers that can be done, and they're also, these are blood, tissue, and urine markers. So.
Well, thank you so much. Any more questions from the audience? Please.
If you have a patient that has gone through the screening process and they need the surgery to have the prostate maybe removed, is there a way to assist with the covering of the cost for that?
I think we'll go to Dr. Johnson on that one. The cost?
I think that's Dr. Coleman's question.
They don't have insurance.
Again, Dr. Davis talked about Montgomery Cares. You know, I mean, you know, that's a place to do it. You know, there's it's free. You know, and have to take advantage of it. But I would also say again, in my experience, you know, in talking with men, even with platinum health insurance. All right, the attitude has to be there, and the disposition has to be there to take care of their health, because it's just call it a man thing. You can call it toxic masculinity. You can call it being strong, or however you want to call it. I think that again, I think that the notion of normalizing the conversation, but it normalizes once we keep talking about it, and talking about it in an encouraging way and not a threatening way, and not a way that casts blame. I think there's a certain way. I've been working with issues of black men for over 3 decades. All right, in a man-to-man conversation, is not a horizontal conversation. I mean, a vertical conversation. It's a horizontal conversation, and you got to talk eyeball to eyeball, and you have to talk in a way that they can see themselves from an empathetic posture, that you are concerned and that you're just passing on information that's going to be helpful for them in the long run. But it's making. We have to use the media in this. Again, one of my community partners is WPFW, and WPFW allows me twice a month to come on and talk about Black Men Health Matters, and we get calls into the African American Health Program office. I appreciate you saying that. That's good to hear. When is the next time you're going to have something where we can talk about this? And just be mindful of the fact that black men are not used to hearing this, because a lot of black men don't think that a lot of us care about them enough, to really, to really be supportive in that type of way. And we have to let black men know that they're valued, they're loved, and that we want them. They have a right to live long, but they got to want to be live long too. And if they want to, then they'll know. Then the other part of that is knowing your biometrics. Getting your physicals. Getting your PSA exams. See, that becomes part of the conversation.
Know your numbers.
Know your numbers. You got to know your numbers.
Oh, thank you so much. We're going to conclude, and I think I'm sorry.
We wanted to discuss a little bit of the masculinity question as well. And I wanted to say to the gentleman that asked the question about where do you get the financial support, I think you ask it because in your profession, often the patient navigator in a cancer center is the person that you speak with to get information about financial support and so forth. And there are also brochures concerning that as well. But on the point of masculinity, the doctor and I, we said I'm going to bring up the point, and then she's going to finish it off. Earlier we talked about masculinity. What we were saying basically is that as a man, you want to get these exams because you want to be valued. You want to be around to walk your daughter down the aisle, to do all those things that men enjoy doing. And the only way you're going to be able to do that is by taking care of your health. And as you take care of your health, it enhances your masculinity anyway. And so the masculinity piece is that digital rectal exam, they're not going to change not gonna make you less masculine.
That's right.
The point of your being healthy is gonna make you more masculine and gonna allow you to live longer and see those things that we grandfathers enjoy seeing. You know, my granddaughter's a fresh woman at Howard this year. I'm here to see that, and I hope to see her play basketball here in a few days as well, you know. So you want to be here for those types of things.
All right, thank you so much. Dr. Coleman, I'll let you finalize since, continue.
Well, I would just say, to finalize that silence is deadly.
Yes,
Silence is deadly. So I really appreciate this program. I really appreciate being invited and being amongst all my wonderful panel members. But you need to know, if not the wife or the husband or the mother or the father, the brother, what your numbers are, what your PSA is. And so if nothing else, if one of you, when you leave here, if you go and talk to another man about what you heard today and that how important that is, I think I will feel much better about it, and I know all of us here will. So, thank you.
Thank you so much.
Each one teach one.
Yes, yes. So,
I would like to make one other request. We're working with the University of Maryland Greenbaum Comprehensive Cancer Center to do a cancer needs assessment of the state of Maryland. And we're seeking to get responses to our 10-minute survey from 50 people per county. We have at least 20-some from Montgomery at the present time. And I would encourage you to get the kind of yellow and orange brochure right there, and scan that and take 10 minutes to fill that out. We have a $15 gift card for you as well. And there are places in there you can write in. So you can write in things like the need for the free PSA exams, the need to provide services for undocumented people. And we did the survey in 2020 for that cancer center, and for 10 counties. Now we're doing it for 20 for the whole state. So we're looking for those 1,200 responses to come in, and that will help drive that cancer center's efforts and work over the next several years as well.
Awesome, thank you. So in closing, first of all, I want to thank our incredible panelists for sharing their experience and expertise today. And thank you to everyone who's in attendance, even the ones that left. But, thank you for coming out. Together, our voices are loud. Early detection saves lives. Awareness gives power. And showing up, like you did today, makes a difference. Keep the conversation going. And again, silent fight, loud voices. Awareness equals power. Early detection equals life. Give your dad, brother, a high five or a PSA thank you. Thank you all. I appreciate you.